Good afternoon. I'm Lucy Hederman, a collaborator in the ADAPT Centre and a lecturer in computer science in Trinity. And I've been lecturing and researching in health informatics for most of my career. And I'm currently leading the heterogeneity and interoperability challenge, which is part of the transparent digital governance strand of ADAPT 2. And this challenge is very much focused, in fact, on interoperability of health data and of metadata about health data, which I guess is how I came to be leading it. So healthcare is a data-intensive domain with escalating quantities of increasingly complex data, in addition to clinical data that we would have had in a traditional hospital chart. Modern healthcare has access to novel biomarkers, omic data, sensor data, patient app data. And if you apply machine learning techniques to all of this data, and you have a powerful engine for research, clinical research, innovation and improvement. But this research and innovation depends on the availability of relevant, high quality, meaningful data. ADAPT is combining cutting edge data science and semantic technologies to support data integration, data analytics and machine learning for applied clinical research. And ADAPT researchers are developing the next wave of methods and standards to support transparent, context aware, quality controlled and policy compliant integration of varied data to support the discovery of clinical insights for data-driven precision medicine and the analysis and discovery of novel and digital biomarkers of disease progression. So I'm going to tell you a little bit about some of these projects and the challenges within them that ADAPT is addressing. Precise 4Q, which has health insurance and medical software industry partners in it, amongst others, is an EU project which aims to bring predictive modelling to the prevention, treatment and rehabilitation of stroke. Our ADAPT colleagues in TU Dublin, led by John Kelleher, whom you've seen, are involved in the technology layer, the blue layer here, the fancy advanced machine learning stuff. They're developing predictive models. But I want to draw your attention to the fact that they admit that all the grunt work in this project, all the effort is on the data integration of multidisciplinary data from multiple clinics across multiple jurisdictions. And this is a theme we'll see again. Real clinical data is messy. Different clinics collect different data in different ways, despite standards, and more so, of course, across national boundaries. In the panel discussion, Dave Lewis mentioned a project, he didn't name it, which is investigating the environmental triggers of autoimmune disease. A specific autoimmune disease called vasculitis. This project called AVERT is led by consultant nephrologist and ADAPT researcher, Professor Mark Little. And the project integrates temporospatial environment data, so pollution and weather particularly, with clinical and patient generated data from the Patient Empower app, which we've worked with them to generate. And it makes it available to our statisticians, Arthur White and Jason Wise, to search for patterns and to build prediction models for ultimate clinical use. So bringing the insights back to the treatment of the patient. The key challenges in this project are semantic data integration, again, data governance, and the need for novel statistical techniques. For rare diseases such as vasculitis or motor neuron disease, about which I'll say more in a moment, there isn't enough data in Ireland to draw conclusions and model predictions. So we're working on international efforts to make collected data available. In some cases, we're actually centralizing multinational data. In others, such as the one represented here, the EU-funded Fairvac project, which deals again with vasculitis, we're adopting a federated approach to allowing researchers to access vasculitis registry data across Europe. Vifor is a renal pharma company that's involved in this project and a big funder of this project. And so data will stay at the remote sites, and a subset of registry data will be extracted to local Fairvac versions of the registry represented in the red clouds here. But these have to be in semantically harmonized form so that we can issue queries across them. These queries will be co-designed by project partners and issued against these local triple stores. And the queries will only return aggregated data. They won't provide access to any individual record for data protection reasons. And the key challenges in Fairvac and similar projects are, again, data interoperability and data governance. Achieving interoperability involves consideration of every data item of interest in each registry and trying to agree what the canonical representation should be using standards where available. And then designing mappings from each item to that agreed version. And Declan O'Sullivan, whom I think you'll meet later, is the expert here in this project. Fairvac and any project involving individuals' health data, of course, has to do with significant data governance issues. ADAPT is exploring techniques to understand, model, and automate data governance, data quality, data provenance, representing where information has come from so that we can track back and make sure it's reliable, for example. And we're using semantic web technologies to do this. Ray Walshe will speak shortly about ADAPT's collaboration with industry around these topics, data governance topics. Mark Little in ADAPT, who's the vasculitis expert, is leading the EU-funded Helical Innovative Training Network, which is training 15 PhD students across Europe. Again, the focus is vasculitis, but the science is generalizable across immune diseases and beyond. Industry partners, mostly bioinformatics companies, provide technology and industrial placements and funding. I've listed some of those partners here. ADAPT is collaborating with Professor Hederman, a consultant neurologist at Beaumont, an international expert on motor neuron disease. The overall goal of this collaboration is to generate a sustainable precision medicine-based solution for heterogeneous and rare neurodegenerative diseases, motor neuron disease being the classic. Drugs to treat these diseases need to be targeted at specific cohorts of patients based on genomic and other novel biomarkers. As we've been doing in the Fairvac project, ADAPT will be integrating pan-European, multi-source, multi-format, multimodal and longitudinal data using semantic web technologies to address heterogeneity and data governance. ADAPT machine learning experts, led by John Kelleher, whom you've met, and Rob Ross, will be developing semi-automated cohortization of patients to identify subgroups with minimum variance for given selection criteria. Studying these cohorts should result in insights on how to provide more precise treatments, which is of obvious interest to the pharma companies, those involved here and others. And the research will also give clinical research organizations such as IQVIA a quick and efficient analysis of the pan-European data set, enabling targeted selection of patients for constructing clinical trials. Separately but related, the HSC, icon bottom left, are launching a shared living lab focused on the use of digital in multiple sclerosis, another neurological condition. Another line of health data research in ADAPT concerns patient-generated health data, which is of interest to patient app companies, such as our partner Patient Empower, as well as to wearables and telemedicine companies. Damon Berry and Dimfan O'Sullivan in TU Dublin and I are looking at how to integrate this data into clinical decision-making and into the EHR. Again, interoperability is a key issue. Whereas traditional health data has been standardized, patient-generated health data hasn't. One of our PhD students is looking at what might help clinicians to trust patient-generated health data for clinical decision-making, and data quality, data provenance, data governance are all important aspects which ADAPT is well placed to address. ADAPT is involved in other health-related initiatives, about which I won't say very much, but we have a Centre for E-Integrated Care. Aphra is a partner in this project, an IoT platform company, and we've been involved in intelligent search projects in the health space, pharmacovigilance and COVID. And I'm going to wrap up with a slide showing the mugshots of the people who are involved in the health research within ADAPT here. This is a growing number of people, but this is the current set of those people. And thank you for listening.